Our first speaker, I think you'd better introduce, yes.
Yeah. It's my absolute pleasure to introduce the first speaker, that is Professor Paolo Leonardi, founder and president of APiC, that is the Italian Association of Patients with Cholangiocarcinoma, based in Bologna, in Italy. And it's a real kind of new association, small, but it's growing very fast with the help of patients, families, friends, and also we collaborate a lot in Italy, and also Paolo is collaborating with the other advocacy groups worldwide. So thank you so much for being here, Paolo, and please.
Thank you to you for the invitation. I will present what we did up to now. The Italian Association of Cholangiocarcinoma Patients was established in January 2019 by 7 individuals, patients, former patients, and caregivers. All people are volunteer. The group is still small, but not that small. It took some months to get up, deciding a few first moves, having a proper site, thinking about how to reach other people. We call our association APiC, which is the Italian way of reading, just a short of it. APiC first public show was in November of 2019, the same year, at a small meeting in Milan, reported in the major Italian newspaper, Il Corriere della Sera. And this was kind of our very first start. Since then, we have continuously got messages whose most common question is where to turn for help. In 2020, the official cholangiocarcinoma diagnosis in Italy, by statistics, were 5,400. And there were about 12,500 people living with a diagnosis of cholangiocarcinoma. In 4 years, we got about 600 requests for help. The first minimal help we offer is the list of Italian medical centers specialized. The list can be got on our site. Still, I think it is the only list of Italian medical centers specialized for cholangiocarcinoma. Those centers are unequally distributed in my country. Most of them are in northern Italy, some in central Italy, and 2 plus half and half in southern Italy. By half, I mean there was an oncologist or there was a surgeon, but not a team. When someone contacts us, we open our reply stating that we are not physicians. Then, depending on where people are from, we suggest teams where to turn for help. If people ask for it, we help them to contact any of those centers. Some people look for a mentor, and we put them in touch with one. The exchange of experience and information has become an important dimension, mixing data and building solidarity. Like other charities, we collect money in many ways: dinners, chocolate, cakes for Christmas, for Easter, donations, but still too little money. The first aim is to fund cholangiocarcinoma research. The second is to help, this is very difficult in a country like mine, to help low-income people deal with the illness. Of course, part of what we collect is invested in making known the pathology and APiC itself. In February 2020, the COVID-19 epidemic blew up. It lasted more than 2 years with almost no public event. Apart from collecting money and participating in webinars, we didn't do much. In 2022, we organized a first small meeting in Florence and one-day meeting in Bologna. The second meeting was centered on patients and caregivers. There were about 15 oncologists and surgeons specialized in cholangiocarcinoma and one nurse, And, oncologists, surgeons, and nurses replied to the patients or the caregivers, to the narratives. The meeting could be watched online too. You can still look at some small video clip on YouTube. Two of the attending physicians commented that it was the first time they got the patient's perspective. We think an association like ours has to start from the patient's experience to let physicians and the community at large to focus on the patient's experience and the many problems patients and caregivers meet after having been diagnosed with cholangiocarcinoma. Physicians do understand, though they have to keep some distance. The public authorities are much harder. This year, we are getting better organized. We would like to prepare a leaflet to drop in any oncologic clinic. A more ambitious idea is a video to present via, in Italy there is a Progress Advertising Association which pays for broadcasting for public things on Italian television companies. The video would hint at what cholangiocarcinoma is and tell that we are here to help, just to let people know. A very big problem is to let people know that there is cholangiocarcinoma, that you can try to deal with it some way. Most people, when they say, I work for an association for cholangiocarcinoma, they tell me, what is it? They don't know. We will hold far more local meetings with cholangiocarcinoma centers in northern and southern Italy. And we plan a second one, national meeting for the next worldwide day for cholangiocarcinoma in February 2024. In the meeting we plan, we want to enter, besides some medical issues, some political ones, issues which people face in Italy, but not only in Italy, of course. Many cholangiocarcinoma diagnoses are late and it's kind of casual. People go to the physician because they have something which is wrong, but the physician doesn't understand. It takes, because he is not specialized, it takes weeks, months before getting the diagnosis. There are good reasons for that, as you know. People don't feel pain. The liver has not that many nerves. And they don't suffer, so they think they are not ill. But we think that this even depends because the illness is not enough well known. People with some risk factors would have to be told to regularly check their biliary tract, for instance, by echo-abdomen or something like that. There are two views on genomic profiling. NGS are looking for the variation for which there are medicines, and we don't know which is the best choice. Genomic profile for all people with a cholangiocarcinoma diagnosis, we think is a test to be done as soon as possible so not to have problems later in the second line, third line of therapy. The test is in Italy covered unequally through the country. And last December, for the first time, the Italian national health system was provided with a small fund to cover at most 200 NGS tests for people with cholangiocarcinoma. We think this is a little thing, little move up. We think that a better organization of assistance to cholangiocarcinoma patients, general strategy and surgery decided in a specialist center has to be routine. And the routine therapies later on has to be made at the closest hospital for the patient. A lot of patients I have come to know travel a lot in Italy from the south to the north, from the eastern north to the western north, and so on. And this is really, I think, insane somehow. National health coverage is a topic going beyond the genomic profile, at least in my country. It faces problems that involve all patients, especially oncological ones, because services are delayed. And the phenomenon is not just a COVID phenomenon. The COVID just made it worse, but that's all. It's a phenomenon, but it is structural because it is 20, 30 years that the Italian national health system has politically been dispreferred in favor of a private or a mixed system. And also because I think statistically, there were mistaken the provision of how many physicians we need, how many nurses we need, no? And this, I think, just always because to save money. The time lapse for new medicine has to become smaller. Concerning those, continental European CCA patients suffer for about 1 year from EMA, the European Medical Agency, and Italian ones have the drug at full price to only 3 years later if they can have it. Because the Italian Agency for Drugs has to get a deal with pharmaceutical companies. But 4 years are a lot too many for cholangiocarcinoma patients. We want patients' representatives to participate in the authorities' table discussing what to allow for and what not for their specific pathology, as well as to the hospital ethics committees, which sometimes have to decide if you can have a drug or don't. We believe that if there were state co-funding, especially partially public and partially private funding for research on new drugs, the national health system could get a better deal later about drugs cost. Then we would like, as I think you all, to have a better knowledge about risk factors. And we would like to see agnostic target medicine be experimentally given also to cholangiocarcinoma patients with a proper mutation. And really, even we would like to know if immunotherapy good for the first line could not be studied even for later lines. A last point. I regret that the UK is not part of the European Union anymore. The UK is too much of European history not to have you with us. Anyway, for European countries, EMA, the European Agency for Drug Medicine, is a first referent. And I would like to see whether we could develop, even together with the British group, a European Cholangiocarcinoma Patients Association. We are here for learning from the oldest charity concerned with cholangiocarcinoma. Thank you.